Jamie, what 90s movie do you think reminds me of babies being born?
Jamie only knows Disney movies from the 90s.
Well, a lot of people guess Lion King, which I feel like is
That's true.
a really good guess because it could be like
Gremlins.
Jurassic Park. No, I'm kidding. Yeah, Alien's a really good one. But anyway, there's so many, like you could basically say any 90s movie and it could apply. But the answer for me was always Coneheads. And if you remember that movie, I mean, do they look like newborns or what?
We wanted to give you guys an idea of what kind of things you can expect that are normal that you could see on your baby within the first couple days, but even up to the first, week.
Yeah, like in the first couple days, there's a lot of normal newborn appearance variations. And so all these things are normal that we're going to talk about right now, but just to kind of prepare you so that you're not concerned. Although if you do see anything that does concern you, even if it is one of these things, always feel free to ask your pediatrician, ask your nurse. It never hurts just to check because it could be something else. And so it's always good to ask questions. Right. First baby, typically, what do you think? Most people push like 2 to 3 hours?
Yes.
Yeah. So it could be up to like 4 hours sometimes, which is like pretty brutal. But anyway, the longer you push, the more likely your baby is going to be born with a big old cone head. And it's pretty amazing, actually. I think it's amazing because, babies, like their bones and their head aren't fused just so that they can mold and fit out of the birth canal. So
the longer the baby's head sits in the birth canal while you're pushing, the bigger the cone head typically.
So that'll go away in a couple days, but oftentimes you don't even see that because all those newborn pictures, they're like wearing cute hats and stuff. But yeah, so yeah, no worries. That's totally a normal thing. It's actually called molding. It's not called a cone head. But yeah, so they'll say your baby has some molding. Yeah, well, because those bones aren't fused, babies do have like soft spots. If you've heard of babies having soft spots, those are just kind of where the bones aren't fused and the spaces in between, they have these 2 soft spots, and that's totally fine. And, just don't go pushing on them or anything.
There's one on the top of the head and then one on the back of the head.
Yes. So the next one is stork bites, and that is when instead of making a baby the traditional way, actually the stork carries it in. No.
Yeah.
But it kind of looks like that. So there's little like red marks that look like little dots, and they're usually on the back of the neck, or sometimes you'll see them on the eyelids. So normal thing, goes away in a couple days.
Yeah. And then also, so when your baby comes out, they will be pretty blue, but they should pink up pretty quick. But the last things to pink up will be their hands and their feet. So blue hands and blue feet should get less and less within the first day or two. But just if you still notice some bluish tint on their hands and feet, just know that that's normal. For the first couple of days. It should not be blue again after that.
Right.
After it pinks up.
Yeah, that's called acrocyanosis if you want to look into it. But yeah, it is totally normal. But centrally, they should be pink after those first couple minutes. And then oftentimes babies also get a normal newborn rash when they are born. So in those first few days, as they're kind of adjusting to air, because they haven't really experienced that yet, sometimes they can get a little bit rashy. So that just goes away on its own. We don't treat it or put anything on it. It just works itself out.
Yeah. Depending on the age of your baby, when your baby is born, they will be born with vernix, and it's kind of like this picture here.
Cheese. I just put a picture of cheese.
Cheese. Your cheesy baby. But it's like a white, sticky substance on your baby. And what it is it protects your baby in the womb from all the fluid, from all the amniotic fluid. The longer your baby is in your uterus, the more that it will go away. So if your baby is born prematurely, 30 weeks, 32 weeks, 33 weeks, even up until like 37 weeks, they can still have a lot of vernix. If your baby is born more around like 40 weeks, 41 weeks, they probably won't have a lot of vernix. And it's not something you have to wipe off when they're born or anything. Just know that it will absorb, it'll go away.
Yeah, it's kind of like a natural moisturizer, very luxurious, and so they don't
So
get all
demure.
pruny. So demure, yeah.
Doesn't even know that.
That's exactly the perfect context for it. So yeah, but the opposite end of the spectrum, if your baby is born later, oftentimes they're really dried out because all of that vernix has worn off. And so you might have a baby that has really dry and peely skin. That's also normal. So that'll just wear off, and just best to let them work through it and not put on any lotions, which could dry them out further.
Yeah. And then next are Mongolian spots, pictured here. They kind of just look like a bruise, and they're typically seen on the buttocks or
The buttocks area.
yes, it's typically seen around the sacral area or around the
Lower back.
lower back. Thank you. Yeah, so Mongolian spots are typically seen in babies with darker pigmented skin.
Yeah, and then another thing you might see on babies is called milia, and that is just baby acne, basically. And if your baby is born with a few little pimples, those will just go away. It's just kind of another common thing that we see.
Yeah. And then also just know that it is okay if your baby's genitals are swollen. We've seen a lot of new parents or even seasoned parents when they're changing their baby's diaper for the first time or something like that. And they're like, whoa, their genitals are so swollen. Just know that it's totally normal to have, in males, like swollen balls, swollen testicles.
Very technical. Don't say balls.
Yeah, so it's just normal. Just know that it's normal if if you have a male baby, if their scrotum is swollen, that is normal. That will go down. You do this.
No, I was gonna say that a lot of parents think it's permanent. Like they think that their baby just has really big balls, and and then I just say, oh, he'll grow into them. Okay.
But for females, it's normal for their labia to be swollen as well. Have I said that? I've said it
I
already.
think we said enough.
Okay, enough has been said. And scene.
All right, if you got something valuable out of that video, please hit that subscribe button, give us a like, and share this video with a friend or family member so that we can continue to share our nursing experiences with you. Thanks.